Emphysema is defined as irreversible enlargement of airspace distal to terminal bronchiole, accompanied by destruction of their walls. Let's draw the diagram. First terminal bronchiole, then the respiratory bronchiole, then we'll draw the alveolus or the alveolar duct, and then the alveolus. Like this, respiratory bronchiole will give rise to multiple alveolar duct. Therefore, after terminal bronchiole, the one in the red box indicates that this space, if it undergoes irreversible enlargement, then this will constitute to emphysema. Now let us deal with the classifications. First is the Centri-Acina type, also known as the centrilobular emphysema. It is associated with heavy smoker, most common in upper lobe. The central or the proximal part of the acini, which is formed by the respiratory bronchiole, is affected, whereas distal part is normal. In the diagram, we have seen that after terminal bronchiole, respiratory bronchiole, so the central part, which is formed by the respiratory bronchiole, will be affected, but the distal part will be normal. Pan-acina type, the next type, it is associated with alpha-1 antitrypsin, lower lobe, and the acini would be uniformly enlarged from respiratory bronchiole to terminal alveolus. Therefore, the name pan-acinar. And the third type is paraseptal, means around the septa. It is associated with the spontaneous pneumothorax, and the proximal portion will be normal, whereas distal portion will be affected in this. This diagram shows that if the proximal part, which is formed by the respiratory bronchiole, is affected, then we'll get centri-acinar. If whole everything is affected, then we'll get pan-acinar emphysema. Let's see the other types. First is the parapsychiatrical, means what? Around the star, means around the fibrosis. Example, PMF, which we'll deal with in great detail. There will be irregular involvement of acini. Second is the bullous emphysema, associated with bulla. What is bulla? A sharply defined lucent lesion with wall margin less than 1 centimeter thick, which will. Let's see the chest X-ray finding in emphysema. First is the increased lung volume, which we see in PA view and lateral view. How we can assess? If it is measured greater than 30 centimeter from first slit to right diaphragm. Second, if there is flattening of the right diaphragm less than 1.5 centimeter. If the right diaphragm is at or below the 7th rib anteriorly, blunting of lateral CP angle. In lateral view, if there is flattening of the right hemidiaphragm less than 2.75 centimeter. If there is blunting of the posterior CP angle. Third is the sternodiaphragmatic angle greater than 90 degree, and fourth is if there is increased retrosternal space or greater than 4.4 centimeter. As you can see in the image, in the PA view, if from the first strip to diaphragm, if the measurement is greater than 30 centimeter, then there is increased lung volume. If there is flattening of the right diaphragm, means from the right CP angle to the right cardiophrenic angle, the distance from the diaphragm to the line, if it is less than 1.5 centimeter, then again it indicates increased lung volume, flattening of the lateral CP angle. Now in the lateral view, we can see that the sternodiaphragmatic angle is greater than 90 degree. Flattening of the right diaphragm in the lateral view is less than 2.7 centimeter, and the retrosternal space is greater than 4.4 centimeter. These all findings will indicate increased lung volume. Now what are the other findings in chest X-ray? Increased lucency, means blackening more, decreased vessel size, and fourth, if there sometimes bulla can be seen, which is sharply defined wall, which we have learned before. So the chest X-ray finding in emphysema includes increased lung volume, increased lucency, means more blackening, decreased vessel size and bulla would be seen. Now let us see the CT features. There will be presence of areas of abnormally low attenuation, means blackening areas again seen in the CT. Let's deal with the centrilobular pattern. What you will see multiple small round low attenuation, most common in the upper lobe, and these are seen in the center of secondary pulmonary lobule. Therefore the name centrilobular. Let's see the diagram, the image in the CT. Now we'll see what is here. We can see the image. We'll draw the secondary pulmonary lobule, and in this the center we'll see abnormal area, which you can see in the image on your right, the arrow mark, the well defined small round attenuation. These are all present in the center of the secondary pulmonary lobule, which we have drawn in the red arrow, and in the center is the abnormal area of the center. Now let us deal with the second type, which is the panlobular type. Here there will be uniform involvement of the pulmonary lobule, therefore the name panlobular. There would be decreased vessel size in the affected area, and it would be associated with alpha-1 antitrypsin deficiency. Therefore, more infection will be there, and if infection, then bronchiectasis and bronchial wall thickening will also be present. Now let us see the diagram. In this diagram, which you can see that here you can see that the whole of this CT, means the panlobular pattern is seen, whereas in contrast, centrilobular, the center of the pulmonary lobule is affected. Here everything will be affected. In the other diagram you can see that one part, whole of the part is affected, which is appearing black, and in that black region the vessel size, means the white part, is appearing. Now the next type is the paraseptal type. The distal part is affected, therefore it is seen near the subpleural location. It is associated with spontaneous pneumothorax, and the differential diagnosis is the honeycomb pattern. But in honeycomb, multiple layers is seen, whereas in paraseptal only single layer is seen. Let's see the diagram. Here you can see that near the subpleural location, you can see that there is low attenuation areas which are present. This is nothing but the arrow mark is also showing those areas. This is paraseptal, the distal part affected, therefore it is in this. Now we'll see the bullous emphysema. It is associated with bulla. Bulla is a sharply defined region with thin wall less than 1 centimeter, associated with vanishing lung syndrome, upper lobe, mostly asymptomatic, but compression of normal lung you can see. Now in this CT, you can see that there is a sharply defined area of low attenuation, means a black area which is seen. This is nothing but a bulla which you can see.